Hello, everyone. Thank you for joining us today for our webinar on buying and selling your medical practice in Ontario. Let me start by introducing myself. My name is Maral Sanassian, the Director of Client Success at DoctorCare. So a little bit about us at DoctorCare. DoctorCare is the largest provider of billing and practice support for over 2,500 physicians across Canada. On average, we've helped doctors recover $25,000 to $30,000 of additional revenue per year. Our solutions and services are designed to help doctors ensure that they are maximizing their revenue, improving patient care, and optimizing their practice. For today's agenda, we're going to first look at starting versus buying a practice. We're going to look at the differences between the two and what decision makes the most sense for you and your needs. We will talk a little about transitioning to retirement, and from there, we'll move on to the questions you should be asking when considering these transitions. We'll then help you answer the question, what is your practice worth? The purpose of today's program is to give you an understanding of the market for buying and selling family practices in Ontario. We want to help you make informed decisions and give you a much clearer picture of how to go about buying and selling a medical practice. Let's start off with comparing buying versus starting a family practice. So why should you buy a practice? Buying a practice means guaranteed income from day one. It also provides you with a steady stream of patients. Getting to a roster size of 1,000, 1,500, or even 2,000 patients could potentially take a very long time when starting from scratch. Physicians with existing practices already have those patients and have worked tirelessly for many years to get these patients rostered to their practice, which is very valuable. Another pro is that you don't need to build out an entire office. If you're taking over an office that is very old and outdated, you might need to do some upgrades or consider moving. However, you're often going to take over the existing space. This helps you save time, money, and a whole lot of stress compared to starting from scratch. If you started your own practice, you would have to find a space, lease the space, and build up your own patient base. In addition, you don't have to worry about staffing. Most of the time, the existing staff want to stay on, and it's in your best interest as a buyer to keep the staff because they know the patients, they know the office, and they can help you with the idiosyncrasies of the office and make sure you run it successfully from day one. There are so many things to consider when starting a new practice from scratch that unless you're entrepreneurial and really want to handpick your patients, it makes a lot of sense to buy a practice. We also know that new grads have accumulated a lot of debt after graduation and don't necessarily want to add more debt. However, if you're willing to add that little bit more to buy a practice, it can get paid off more quickly potentially. That summarizes the pros of buying a family practice. However, there are also some cons that you should consider when thinking about buying a family practice. When you buy a family practice, it is important to note that since the practices existed before you joined, it may be difficult to fit in at the beginning, as the clinic staff has already established their culture and their way of doing things. It's important for you to consider whether the practice you are looking to buy fits within an environment that you would like to work in before you decide to buy it. Another con is that since you are buying an existing practice, you might not get what you expected as the practice wasn't tailored to your needs, but rather of the doctor before you. The practice decisions of location, layout, equipment have mostly already been decided for you. Now let's move on and look at the pros and cons of starting a family practice from scratch. When starting a family practice, you will not only learn how to manage your practice, but you will also learn how to build a business, which is a great learning experience. In addition, you get to make all the decisions when you start a practice as nothing is set in stone yet. For example, you get to create your processes and systems, your business name, where you will be located, how you want your office layout to look like, what office equipment you will need, which EMR you would like, and even handpick your staff. However, on the other hand, there are some cons that are included with this larger responsibility. Because you are starting from scratch and building an entire business on your own, it is riskier. It is likely that in the first few years, you will experience unpredictable income when building your patient roster. And although you do get to make all the decisions, it is a lot of hard work. It's time-consuming, costly, and could be a stressful process overall. So based on the comparisons discussed, should you buy a practice or start one on your own? It really depends on your preference and the time, effort, and money that you are willing to put in. If you are looking to be entrepreneurial, like we mentioned earlier, have some money to spend and want to start from the ground up, we do recommend starting a family practice as it can be quite fulfilling. But if that option is too risky for you and you would rather manage an existing one and have the comfort of an existing patient base and staff, then purchasing a practice would be the better option for you. The next section is for doctors who are looking to retire and need someone to take over their practice. So why should you sell your practice? You've spent years building a practice, so it's natural that you would want to get some value out of a transition. You've established your patient base and you've trained your staff. You have a relationship with your landlord for the years you've been practicing there. You have been practicing at your current location for many years, so you have established a footprint that many patients recognize. You want to make sure the person coming in to take over your practice will care for your patients and your business, and in return, make money for your hard-earned work too. And lastly, there's supply and demand. Your practice is very desirable to other doctors because many doctors want to be in a faux spot with a faux roster and have that guaranteed income. It's not always readily available to them, as only a handful of physicians plan to retire during a period of time. We've had several physicians that we've signed up to help sell their practice over the years, and our goal is to make sure that everyone out there has an equal opportunity to sell their practice and make sure that they can get as much out of it as possible. So now we're going to talk about asking the right questions. Before you make any decision to buy or start a practice or sell, there are some things you need to think about. To further help you decide whether you should buy an existing practice or grow your own, there are some questions that you should consider. The first one is, what are you prepared to spend? As mentioned previously, a turnkey practice will cost much more upfront than one you build up yourself, but you will be operating and making money right away. The next question is, are you ready to add your name to an existing office lease agreement or sign a new one? An established lease in an existing location won't give you the same kind of choice or flexibility as a brand new practice. An established practice will be tied into a location that is convenient to its patients, which limits your mobility and your choice. Third question is, what is their expense reimbursement structure? It is important to ask this question when looking at a practice and make sure the structure works for your needs. Next question you need to consider is if it is a solo or group office. Would you prefer to be on your own in a practice or be a part of a team with other physicians? Fifth question, what partnership and group governance agreements are in place? Will they work for your needs? Ask yourself, how familiar are you with running a faux business? Are you comfortable with the administrative aspects of managing a faux practice and roster? While the faux structure is the most popular payment model within family medicine, it can also be the most complicated. What kind of patients are you absorbing? How many of them are on pain meds, have serious mental illness, are diabetics? When it comes to staff, do the staff want to stay? Do you want them to stay? These are all important questions to ask to really understand what you want from buying or starting a practice from scratch. So what are some questions that you need to consider when transitioning out of a practice? The first question is, what is your practice worth? You know what it's worth to you, but what is its actual market value? Are you comfortable with selling it at the going rate? What it's worth depends on the income it generates month to month, of course, but ultimately, it depends on how much a buyer is willing to pay. Factors influencing price can include everything from location to lease obligations, cost sharing scenarios, to the personalities of your partners. Next question to consider, what does the ministry say? When it comes to selling a family practice, the Ministry of Health has very specific requirements. Do you know what you need to do to properly transition your patient roster and your practice to a buyer? Are you prepared to do everything needed to meet those requirements? When it comes to the ministry, transitioning a healthcare practice has many steps. Bringing in professionals like DoctorCare can make it much easier for you. And lastly, how will your partners feel about the change? When you're selling a practice that's connected to a larger group, that can add complexity, especially when there are different personalities and agendas involved. Let your colleagues know about your plans before you set the wheels in motion. It's the best way to get their support and cooperation. We are moving on to the last part of the webinar, identifying what your practice is worth. How do you value a practice? What is your practice actually worth? We get this question all the time. Many doctors haven't really thought about it. A lot of them don't think they could actually get something for their practice or that their practice has any value. However, you can get a significant amount of money for your practice. When we value your practice, we look at your RAs, your remittance advice, your financial payments, your governance agreements, your lease. We take everything into consideration. We look at paper or EMR charts, newly renovated clinic space or outdated. All of these things play a factor. We look at many different aspects, and since every single practice is different, there is no one-size-fits-all for setting a value. We will sit down with you and go through all these specifics to see what your practice is actually worth. But at the end of the day, you have to be prepared to negotiate. Like any business transaction, there is going to be some give, and we come in to help find the happy medium. We have worked with over 100 physicians over the years, both on the buyer and seller side, to help them get the best deal possible. The service that we offer is very personalized. We have these 7 steps as guidelines here, and yet each one of them is going to vary slightly from physician to physician and from deal to deal. As a general scope, we're going to create a plan, we're going to run an assessment on your practice and your needs, we're going to support the recruitment and replacement process. We're going to manage all the ads. We're going to speak to people, and we're going to liaise with the ministry and take care of the transition paperwork that needs to be done. We work with the buyers, the sellers, and the faux lead physicians to make sure that all the papers are appropriately signed and sent to the ministry in a timely manner. We're also going to review the group governance, do a quick analysis of the lease agreement, and guide you with the patient and staff communications. In summary, when deciding if you should buy or start a practice, the answer is dependent on the time and effort you are willing to commit to the practice. Many doctors think that their practices don't have any value when they are looking to retire. However, there is often high demand and a short supply of doctors selling their practices. Whether it's buying a practice, starting a practice, or selling one, it is important to ask yourself the right questions before you make your decision and commit to it. And lastly, we can help. At DoctorCare, we can help you find your dream practice, help you start a new one, or help you transition smoothly into retirement. We have worked with many doctors over the years to help them achieve what they need. We've come to the end of our webinar. On behalf of DoctorCare, thank you for joining us today. If you have any questions or feedback on this webinar, please feel free to contact me anytime. My contact information is listed on this slide. Have a wonderful day.